This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
The residents of Barangay Bagbag in Quezon City prepare for the rainy season by cleaning and decluttering their community. Their cleaning effort is a preparation for their worst enemy during the season, dengue.
Well, in 2011, we were reported to have 300 cases of dengue. We were number 1 at that time.
Dengue is an infectious tropical disease caused by the dengue virus, carried by a species of mosquito called Aedes aegypti.
Basta merong stagnant water na pwedeng pangitlugan ng lamok, andyan sila, nagtatribe sila, nagpapalago sila, nagpaparami po sila.
Dengue should be suspected when one reaches a fever of 40 degrees Celsius. It should also be accompanied by 2 of the following symptoms: severe headache, muscle and joint pains, nausea, and vomiting.
Tinatawagan po natin yung ating mga kababayan, yung attention po na huwag pong maging komportable, basta panatilihin po natin malinis ang ating bahay, ang ating kapaligiran, ugaliin po natin check-in ang ating mga panubigan.
According to the Department of Health, there were 2,332 dengue cases from January to April of this year. This is the reason why Barangay Bagbag is still continuing their efforts to fight dengue.
Right now, we're trying to educate people so that to lessen the damage of this dengue virus.
We should be afraid of dengue because it's lethal. It kills people. It makes people very sick. Nawawalan tayo ng mga mahal sa buhay dahil sa dengue.
What are the classifications and levels of dengue? Can dengue be experienced even on non-rainy season? How can we combat this disease? Find out the answers tonight on MedTalk.
And to help us in our discussion tonight is Dr. Manuel Mapue, Head of the Regional Epidemiology Surveillance Unit of the DOH-NCR. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, Doctor. Welcome to the show.
Good evening, Angel.
You know, Doctor, our weather is changing from hot and humid to rainy, and with this change in weather comes a certain type of mosquito. Please tell us about this mosquito and why we should be wary about it.
Well, this mosquito usually, to differentiate from the other types of mosquito that we have in the Philippines, when you look at it, usually these are striped that is seen by the naked eye. And this mosquito usually is the cause of dengue fever, which usually increases during the rainy seasons, particularly August, September, and October.
And with this type of mosquito, I remember as a child, every time I'd play outside and it was nighttime already and the mosquito would bite me, we'd try to look at it.
Yeah.
And we'd see like a silver stripe on the mosquito. Is this the one?
You have to differentiate also between the other types of mosquito. The one with the silver stripe, particularly the lyre-shaped silver stripe, is that of the Aedes aegypti mosquito.
So this is the dengue.
Yeah, that carries the dengue mosquito. The dengue virus, rather.
So with this type of mosquito, please tell us more about the characteristics of this type of mosquito, what it causes to the body, and how it bites us. What does it do when it bites us?
Actually, it is only the female mosquito that bites. Or that sucks blood from the human body. The male mosquito usually thrives on plant saps or plant juices. Now, this female mosquito or the female Aedes aegypti bites or sucks blood from the human beings in order to lay eggs. They need the blood of human beings for oviposition.
And how often does this mosquito fly around, or how often is it abound? Is there a certain type of, certain time rather of day, morning, evening?
Adult mosquitoes usually is present at around 50 meters from breeding sites, meaning the water containers. And the flight range of these mosquitoes is between 200 to 400 meters now. And their peak biting time is usually between 2 hours after sunset and 2 hours before sunrise. But this does not mean that they cannot bite all throughout the day.
So 2 hours after sunset?
Yes.
And
2
hours before?
2 hours after sunrise and 2 hours before sunset.
And within the day, it can still...
Yeah, they can still bite.
It can still bite.
Yeah.
But you mentioned also that the rainy season, sometime July, August, they're
Yeah.
more rampant.
They are more rampant, basically because there are more breeding sites around the area because of the pools of water around.
So aside from it sucking on human blood for it to lay eggs, what else does it do to the body? Does it leave saliva? Does it leave a virus? What else does it do to the body?
No, the infected mosquito, once they suck or once they bite a human being, they transfer the virus in the blood system of the humans.
And what happens to the human being once it is bitten by this type of mosquito?
It will take around 1 to 3 days before the person bitten to have signs and symptoms, particularly fever, and this is usually accompanied by what we call periorbital pain or pain around the eyes. And then you have headache, you have muscle pains.
So you mentioned already, Doc, we're already moving into the signs and symptoms. And you mentioned fever and muscle pain and periorbital pain. But sometimes we can liken this to the flu.
Yes.
So what is the difference between the two signs and
Actually,
the two
there are no
symptoms?
difference, but you have, if you get this, or you have to see the nearest health facility.
Right away. I mean,
away,
at the
yeah.
slightest bodily malaise, you have to
right
see
away,
that.
yeah.
How about...
Just to be sure what this is caused by.
So aside from the mention of the muscle pain, the periorbital pain, any other signs to watch out for, and the fever? Does it have to be a certain temperature?
We say that it has to be high-grade fever now, but usually our residents do not make use of thermometers. So sometimes we also consider fever by touch.
Okay.
Yeah.
And you mentioned fever by touch. Now we go to the diagnosis. So aside from touch, what else will the health practitioner do to determine if one indeed has dengue?
They have to get the history, say, do other persons have fever around the area or within the community, so as they can have an idea if this can be associated with dengue.
And you mentioned also the community, Doctor. Now let's go back a little bit to how the community deals with sometimes we have open spaces or open areas that are filled with water that are not cleaned right away. So, pwedeng bahayan yun ng dengue mosquito.
So, if you have open canals or pools of water, you have to declog the canals so as the water will flow. Or if you have pools of water, then you can probably cover it with soil.
Soil is okay.
Yeah.
And for one entire village or maybe neighborhood to be able to do that, of course, we also have to give them a lot of information on how to go about eradicating maybe or preventing dengue and the surroundings. And one way also of preventing or addressing the dengue virus right away is to behave in a certain manner, to wear a certain type of clothing. Is that true?
Yeah. First, of course, you have to self-protect yourself now. You have to wear long clothing, so as not to expose your skin.
But it's very hot sometimes, doctor.
So, long clothes, but not as thick as to cause you to sweat much. Because, sweat can cause odor also, and this can
Yes.
also attract mosquitoes.
Also, odor,
Odor can attract
attracts
mosquitoes.
these
Strong odor
mosquitoes.
can attract
The
mosquitoes.
female, again, we're talking about the female mosquito.
Yeah, the female mosquitoes.
Mosquito. We'll go back to the signs and symptoms
Mm-hmm.
and prevention, doctor, in a while, but we have to answer a Facebook question from
right.
Sylvia. Can dengue be transmitted from one person to another?
It cannot be transferred from one person to another. It has to have a vector, which is our Aedes mosquito.
So there's this notion na if someone in the household has fever or is suspected to have dengue, and then another member of the household nagka-dengue rin, parang nahawa.
Nahawa in the context of those living within the household, but it cannot be transferred to another person if the mosquito is not present within the household or within the neighborhood.
Okay. We mentioned the household and neighborhood. So not necessarily that the dengue mosquito will thrive outside of your home. It can also thrive
It can
inside.
also thrive inside their home.
How is this possible?
Well, there are a lot of also artificial water containers inside your house. Say your flower vases, flower jars, your water containers inside, or your refrigerator drainage, your refrigerator fans, your air conditioner drainage.
So almost anything that can collect water
Yes.
inside and outside your home, you
Yes.
have to be careful and clean all the time, no?
yeah.
Every day if possible.
Yeah, you have to clean it every day and be assured that there are no water containers inside.
And then we go to another question from Facebook, doctor. It's from Nerissa. Aside from stagnant water, we were talking about this, doctor, what other breeding sites are the other breeding sites of mosquitoes?
Well, particularly anything that can hold water.
We mentioned earlier, even your
Yes.
flower vase,
Yes.
even maybe things lying around the house that just can
Even
collect.
even plant axils, bamboo stumps, coconut husks.
And artificial plants, not necessarily.
Yeah, and artificial plants that can
as
hold
well.
water.
Okay, another question, doctor,
sure.
from Twitter. I had dengue before. Very interesting question. Is there a chance that I will catch it again?
All right. A person can have dengue the maximum of 4 times, basically because we have 4 serotypes of dengue. And one serotype cannot give protection to the other serotype, or they have no cross protection to other serotypes. They can give only lifelong immunity to the same serotype.
What do you mean when you say serotype and the 4 types, the 4 serotypes of dengue?
Actually, these are dengue viruses with the difference only in their genetic makeup.
Okay.
Yeah.
So if you're
So we
bitten,
have dengue 1,
Yes,
dengue 2, dengue 3, and dengue 4.
and the difference between 1, 2, 3, and 4 is
The
the
genetic makeup.
genetic. So like the question on Twitter that if you have had dengue, you can get it again up to
You can
4
get
times.
it again up to 4 times. And as you get the infection again, as you get reinfected, then there are chances of you will have a more serious infection.
And I was about to ask, is that does it indicate that you will be immune to that bite? And you mentioned that it would be a more serious case the second time
Yeah.
around.
Yeah.
Okay, we'll talk more about that,
Alright.
doctor. MedTalk will be right back.
Did you know that a mosquito could smell its new host between 20 to 35 meters? Mosquitoes do not have a scenting organ, but they do have a highly sensitive antenna to identify odors. This antenna is covered with sensilla, or fine scenting hairs, and each hair is like a miniature nose.
We're back here on MedTalk, still talking about the signs and symptoms and early detection of dengue. Doctor, before the break, we were talking about the four serotypes of dengue.
Serotypes
Is there a test that can be administered to an individual just to prevent these types of mosquitoes from biting us?
Yes, there is a test, but we don't do it routinely. This is a requested test, and we also do this if we suspect outbreaks. No? And we call this test as polymerase chain reaction test, or PCR.
So one can go to the hospital or one can go to their doctor and request for a test like this during the rainy season?
If they want to find out what type of or serotypes they have, or if they want to find out also if they had previous infections. We have other tests also that we call NS1AG. This is an antigen test. We want to know if the antigen for dengue is present in that person. Or we can do an IgG or IgM test, which determines whether this infection you had is a previous or a new infection.
How about a vaccine?
With regards to the vaccine, we're supposed to come out with the vaccine next year, 2014, but we just want to be sure of the protection that it will give, so probably it will come out in 2 years' time yet.
And we speak of protection as a mother, and I'm sure the mothers, the parents out there want their children protected from this mosquito. Is there a way that the children can be spared, or that even the adults, when it comes to this mosquito?
Well, still the best way is to be assured that there are no bleeding places in your area or within your household, or office or school also.
So we really have to stress that we have
Yes,
to be
and
mindful of our environment, of our surroundings.
Yeah, definitely. Yeah.
And earlier we were talking also about the type of fever that one will have, or that one will experience when one is suspected to have dengue. So not necessarily a high-grade fever, meaning that
Yes.
you have dengue. And sometimes, doctor, all these signs, all these symptoms are not treated right away, maybe for the lack of want to bring them to a healthcare practitioner, maybe even in the provinces. And how does one address this concern if one is at home?
Actually, not all dengue cases has to be treated at the hospital. No, most of the dengue cases, especially when these are brought to the health facilities early, they can be treated at home. Basically, you just have to hydrate your patients. You can make use of your aerosol, or you can come up with your homemade aerosol at home.
What is an aerosol?
This is an oral rehydrating solution that replaces the electrolytes lost from the leaking fluids in your body. Because basically, the dengue virus targets the small blood vessels that leaks fluid, and you get dehydrated, which is basically the cause of death in dengue.
Okay, so for those who are at home, they can just keep hydrating themselves.
Yes.
And when should they go to the doctor or the hospital?
If there are signs already of bleeding.
Bleeding.
Yeah, especially if you have rashes already.
What type of rashes are
We
evident?
usually start with pinpoint rashes.
Pinpoint
Yeah,
rashes.
they start as pinpoint rashes.
Okay.
And you experience already abdominal pain. That can be also a sign of bleeding.
So the muscle and joint pains, the headache, and the pain in the eyes is still not leading to abdominal pain and bleeding, so it can still be treated at home.
Yeah.
Treated at home. Is there a medicine? Is there oral medication that can be taken when one
Actually,
has
we don't
dengue?
have specific treatment for dengue. What we do only is our symptomatic treatment.
What kind of treatments are given, doctor?
Let's say, first is you can give your aerosol. If you have fever, you give paracetamol, but not aspirin.
Okay, why not?
Because aspirin can induce bleeding more by causing erosive gastritis.
So at home, kasi 'di ba, konting fever lang now, for the lack of a kinder word, there's a panic because nakoyo fever, baka you're suspected to have dengue.
Yeah.
So
Especially if it is the dengue season. Yeah.
if it is the dengue. So paracetamol at home is okay.
Yes.
And then if the fever continues, is there a rapid change in the temperature of an individual who is suspected to have dengue? Or is it a continuous 39 or 38 degrees Celsius grade?
It depends on the individual. It depends on the status of the individual. Sometimes you will have rapid change, but sometimes it plateaus first before it goes down. Depends.
Is there a difference between a child who is suspected to have dengue and an adult?
Difference in what way?
Maybe signs and symptoms? Or
The signs and symptoms are marked in children and the older ones, and the immunocompressed ones.
Okay.
Yeah.
So marked meaning
It is more intensive.
more intensive. And same treatment
Same
that will go
treatment,
into
yeah.
the child and the adult. Doctor, how about the plans or the preventive measures of the Department of Health in educating and making sure that the barangays, that the subdivisions and neighborhoods are protected from this type of mosquito?
The Department of Health, particularly the National Capital Region, came up with an initiative which we started in last August, wherein we advise the community to report directly to either our office, the Center for Health Development National Capital Region, or the nearest health facility in their residence. If they come to know of a dengue case or if their relatives have dengue. And once we receive this report, we immediately notify the nearest health facility wherein the case resides. And we also inform the barangay officials, and we text them suggestions on what to do in the community. The objective of this is to make the community aware and make responsible for the dengue situation in their areas. And after almost 1 year of this initiative, you can see that the national capital is no longer among the top 5 with the most dengue cases in the nation.
That's good to know.
Actually, we're number 6 already.
Wow, that's good to know that people are more vigilant.
Yeah,
People do report to the DOH
They
if
do
they
report.
know of dengue cases in their area.
Yeah.
And what other measures will the DOH be taking during this rainy season?
We also advised the residents and school officials as well as the companies to make sure that there are no breeding areas, breeding sites in their respective facilities.
And for the mothers out there,
And
the
for the
parents,
mothers-
the teachers even who have their kids with them, 6 hours, 7 hours during the day?
Yeah, we all know that the teachers are the parents of these
Yes.
children at school, so they have to ensure also that these children are protected. So in schools, we also advise the school officials to make use of our treated nets, our treated screens, and this has been used by some of our schools in Metro Manila already. Wherein these nets, which are treated with chemicals against dengue, are used as screens in their windows and doors. Yeah.
Okay, these are this is the directive of the DOH for
Yes.
the
And just
schools.
recently or last week, we have already sprayed and disinfected around 39 to 40 schools already in Metro Manila.
That's good to
Just
know.
in time for the start of
Start
the
of
classes.
school,
Yeah.
yes. Thank you, Doctor, for that. We'll go back to that in a little while. Now we have to
Thank you.
answer a Facebook question from John. Can we use natural insect repellents to
Yes, we can,
prevent
but
dengue?
we have to know first how long will these repellents last, because you have to reapply.
How often should one reapply?
Depends on the repellent that is used. Then we have to know first how long will this last in the skin. Sometimes every 2 hours you have to apply, and every time you get wet, you have to reapply.
How about a mosquito patch? How long is the effectivity of a mosquito patch?
I'm not sure the mosquito patch, but it also depends on the manufacturer.
Because like what you mentioned with reapplying the insect repellent
repellents,
every 2 hours, and the mosquito patch, sometimes you see it on the child the whole day, so maybe it has no more, it's not as effective anymore.
Probably, and we also have long-lasting repellents.
So talagang we should check the label,
have
and we
to
should
check label.
be more conscious of when we're out, like in an area where there, na pwedeng
yes.
pagbahayan ng mosquitoes, to reapply and change the mosquito patch maybe every 3 hours.
Yeah.
Another question, Doctor, from Twitter. Are there alternative medicines that can prevent or treat dengue? This question is from Kay.
There are a lot of alternative medicines being suggested, but still the best way is to make sure that you have no breeding sites. No? Some of the alternative medicines that have been suggested is one, the lemongrass. But what is effective in the lemongrass is its oil. You have to get the oil and apply it to your body to be effective.
Okay.
Another one that is suggested is tawa-tawa, but this has no direct effect on the dengue virus, but the action of tawa-tawa is just to stimulate the production of platelet.
Okay. You mentioned platelet because when one is suspected to have dengue, the platelet count drops.
But remember, it is not only dengue that the dengue virus that lowers the platelet count. There are also other diseases that can lower your platelet count.
And when one's platelet count is low, what happens to the individual? In this case, we're talking about dengue.
Then if there is also, if there is already leakage, then it may lead to more bleeding.
Okay, so again, go to the doctor ASAP.
Yes, because remember that platelet usually clamps together to patch the broken blood vessel. But if it gets lower, then there are no platelets anymore to block the leakage.
And this leakage, the type of blood that flows through one's body when one is suspected to have
Actually, it is
dengue.
not the cells but the fluid, the blood fluids.
What is the consistency of this type of fluid, of the blood?
It's viscous, clear.
Clear. It's no thickening of the
That's
blood.
why when there is leakage already, your hematocrit goes up also. No?
When there is leakage already.
there
And of
is
course, these are
leakage already.
done at the hospital. These are the tests
these are
conducted.
checked at the hospital or even at the health facilities.
The health facilities are
They are capable
equipped
of doing
and-
this. Yeah.
Okay, thanks, Doctor. Another question from Angel, Facebook. Is there a way to increase your body resistance to prevent getting the dengue virus?
Well, the usual things that increases your body resistance: sleep early, eat the right food, drink vitamin supplements, no vices, no smoking. That's it.
Okay, how about clothing? You mentioned earlier.
With clothing, yeah, you just wear long sleeves, long pants, and wear light clothing, and be sure that you have no body odor.
No idea. How about perfume? That can attract the smell.
Just use light perfumes.
Okay, you mentioned, I'd like to go back a little bit to the light clothing. So, what is there a particular color during this season that we should avoid?
Just avoid dark-colored ones, especially black colors.
No, black. All throughout the day, not at any particular
Yes,
time anymore. Only during this season when dengue
And
virus
just
is
make
rampant.
sure that the rooms are well ventilated, and just make sure that you have no curtains, because the mosquitoes can also hide in curtains.
Any other last tips or messages, Doctor? Or maybe the 4 S's of the preventing dengue before we let you go?
Still, we still advise our residents to make sure that you implement the 4 S's that have been suggested by the Department of Health for several years now.
Yes.
The first S states that you have to first search and destroy breeding sites in the area. That is still the best way wherein you can be assured that you will not get dengue. The second one, if this does not take effect in your area, then you have to do self-protection. Now, you have to protect yourselves by using repellents or modify the way you dress. No? And then the third S stands for seek early consultation once you feel something different from your body. And the fourth one is you have to use only fogging when it is intended or when there are outbreaks.
Okay.
Yeah. And another one is the 4 o'clock habit was coined just to standardize the time of cleaning your surroundings. But actually, you have to be sure that every time of the day your surroundings are clean and there are no water holding containers within the area.
It's also good to know that there's a 4 o'clock habit, and
Yeah.
there's a habit that we should keep, we should maintain, we should remember when
Yes,
cleaning our
and
surroundings.
lastly, we have to bear in mind and we have to be aware that it is us, the residents in our community, that actually are the cause of dengue.
Because if we don't clean our surroundings, then may pagbabahayan
And may pagbabahayan.
ang mga mosquito. So
Yes.
it's homeowners' responsibility
Yes.
to clean their surroundings and make sure that this mosquito doesn't thrive in that area.
Yeah.
So thank you very much, Dr. Mapwe, for your valuable insights and for helping us understand and for helping us deal with the dengue virus during the rainy season.
My pleasure, Angel.
Thank you very much.
Yeah, thank you.
Again, I'd like to thank Dr. Manuel Mapwe for helping us understand and know more about the dengue virus. See you again next Tuesday on MedTalk as we talk about prostate. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.